Dr. Kevin Kavanagh is a retired physician, and also he is founder of a national organization called Health Watch USA. He joins us now. Good morning, Dr. K.
Good morning, Jack.
We're going to talk about COVID for sure. Tell us about monkeypox.
Well, monkeypox is a DNA virus. It's similar to smallpox. And it's a virus that's been around a long time. We know a lot about it. It doesn't spread nearly as fast as COVID-19. And we have effective vaccines and even medicines to treat monkeypox. So I do not think that if this virus behaves like the previous monkeypoxes in the wild, that we're going to have much problem in containing it with public health measures. In other words, they can do ring vaccinations, case tracking, etc. This virus does not spread significantly by aerosols. It usually spreads by surfaces, requires close contact. And because of that, I don't think it's going to be a huge issue, but I do think it is very peculiar that we have an outbreak in 14 countries at one time. And that I think is, really peculiar. And they can't, from what I understand, establish a common thread in all of these outbreaks. And as I said, this virus classically isn't that infectious, at least compared to SARS-CoV-2.
And so at this point, no alarms are going off as far as you're concerned.
No, I think we need to be vigilant, but I agree with you that alarms are not going off similar to COVID.
On Sunday, by the way, President Biden shared his concerns over monkeypox, which has been spreading, as you mentioned, across the world, 14 different countries. They haven't told me the level of exposure yet, is what the president said, but it is something that everybody should be concerned about. Said to the press on Sunday as he made his first trip to Asia since becoming president, we're working on it hard to figure out what we do, what vaccine may be available, but it is a concern in the sense that if it were to spread, it would be consequential. As of Saturday, 92 cases of monkeypox had been detected in 12 countries. That's up to 14. And I understand we have a couple here in this country, right?
That's correct. We've had 2 cases, and it is something that you need to be concerned about, but I don't think at this point alarms and panic. You need to remember that we're dealing with 100 cases of monkeypox, which is a virus that doesn't have asymptomatic spread. We know what it does. And this is compared to now 100,000 cases a day with COVID-19, and that's increasing. So COVID is still what we need to focus on, and the public health measures for COVID will control monkeypox. I think it'll be similar to what we've seen with the flu 2 years ago, that when we start to institute public health measures to control the spread of COVID, the flu just disappeared. So I think that we need to keep our eye on the ball with COVID-19. As you know, several weeks ago, everybody was saying, well, it's going to go away during the summer. We got to worry about the winter. And I think we were discussing how, well, that didn't happen the last 2 years. Last 2 years, we had a spike, and I suspect that would happen again this year. And sure enough, that's what we're seeing is a spike in COVID-19.
Over the weekend, I've heard personally of a few people that I either know or people that I know of, including one of our employees here at the radio station. He doesn't have it, but it's in his family, so he didn't come to work today. Is it just my imagination, or are COVID cases really picking up in Kentucky?
Oh, no, they're picking up in Kentucky. We've had double the amount of COVID over the last several weeks, both in cases and also in hospitalizations. And we're not going to get a big summer flu peak. I mean, flu doesn't peak in the summer. It's not that infectious. The summer tends to snuff it out. What we're dealing with is the highly infectious virus of COVID. And of course, hospitalizations are very concerning, as is even mild infections, because of the reports that we're getting of long COVID and the frequency of long COVID. So this is a virus we want to really be careful of. We want to take measures to keep from getting it. And people are getting reinfected. Even if it's a mild case, we can't have the workforce having massive infections and being out of work 3 times a year. that's not good. Just as it's not good to fly on a plane, get a cold, or get sick in bed for 2 weeks, and that's how you spend your vacation that you spent the last couple years saving up for. So public health means just that. It's health of the public. We need to watch out and respect the health of others.
Okay, cases are rising, as you say, and do we just need to wear masks if we go outside, period? When we leave our houses is what I mean, not necessarily outside, but just if we're out beyond our homes, should we be wearing a mask?
If you're high risk for COVID-19, I certainly would consider that, because even outdoors, if you're within 6 feet of someone, they can still transmit the virus. And unfortunately, in our area, I'll oftentimes be walking out on the sidewalk. Someone will be riding by on the bicycle, come up behind you. He's huffing and puffing, and you'll get large droplet spread. Aerosols tend to dissipate pretty well outdoors. Now, if you're planning on going to an indoor retail setting where you're going to meet a lot of people that aren't within your family unit, that you probably need to wear a mask. And by a mask, I mean an N95 mask, which some people also call a respirator. Those are readily available on the internet. And certainly you have options of curbside pickup and also ordering online. All of those can be done, which decreases your chances of getting the disease.
All right, how about kids and getting the booster shots? I understand that the CDC signed off on Pfizer's COVID boosters for children 5 to 11.
Yes, and I think that's very important. The initial vaccine, the 2 doses, at 2 months' time, only gave about a 30% efficacy in preventing symptomatic disease. Now, overall, vaccinations cut the chances of your child being in a hospital in half, which is very good. And of course, that's an infrequent occurrence, but it can happen, and it's a disaster for your child. But these vaccines have been shown to be very safe. They've been around for, right now, over a year. There's a lot of safety data on them, and I would certainly encourage your child to go out and get a booster. And right now, it is the Pfizer vaccine which they are giving these for, and that's the vaccination brand for the children.
And young children with vaccinations half as likely to be hospitalized?
That's correct, and that's one of the big advantages, because the pediatric hospitals did fill with the Omicron wave. And these vaccines are protective. They are something that will lessen the severity of the disease, and we still don't know what the long-term effects of this virus are in children. So we need to be careful. We need to protect our kids. The other factor is these children can spread the disease. They spread it to their caregivers. I think the United States has lost over 200,000 caregivers to children to COVID-19. And as you know from the serology data, which was recently published, it appears that children, 75% of them have already had COVID-19 or a previous SARS-CoV-2 infection, and that compares to about 50% of the adults. So the kids are spreading it very well. And unfortunately, we're seeing more and more reinfections. So just because your child had an infection doesn't mean they won't get it again, and vaccinations are encouraged.
Dr. Kevin Kavanagh is our guest this morning as we go to our Stuttgart Motors text line. Dr. Kavanagh, ask your doctor, why are the cases in hospitals mostly the vaccinated? Is that true?
Well, most people are vaccinated, and so you're going to have a significant number of people who are vaccinated are getting reinfections, especially if they're elderly and they have not had their booster. And unfortunately, very few people in Kentucky have had 1 booster, let alone 2. With Omicron, there's very little protection with a 2-dose vaccine. So you need to keep your immunity as high up as possible. So yes, if you have the majority of people who are vaccinated but only have a 2-dose vaccine, they're not going to be protected very well. So you need to go out and get a booster, and that is key.
And if you're in that category and it's been more than 6 months since you got the booster, then you should get a second booster, correct?
That's correct. After 5 months, second booster. And you really want to do that. And to be honest with you, if you've got a severe immunological problem, or if you've had a transplant where you may not react well to a booster or get proper immunity, you should get on another product like the Evusheld in order to give you some passive immunity, which is good for approximately 6 months. And so please go out, get treated, and get your immunity as high as possible for these surges which we are now experiencing.
Okay, now experts warn of a COVID-19 wave that they are saying is, quote, almost like Omicron. What is that?
Well, that's a wave where you have a very infectious virus. In other words, it's a virus that spreads rampantly through the population. It may not have as high a case fatality rate, but because of its high infectivity and the waning immunity in our population, we still see a large number of cases and deaths. And remember, the big question that you want to know is, what are my chances of getting sick when I go in and do a certain activity? And that's a combination of the lethality of the virus and its infectivity. For example, monkeypox. Monkeypox can be much more severe, but it's not nearly as infectious. So that in itself may not be as risky of activity as going into a setting with COVID, where the virus is aerosolized and highly infectious.
Got about a minute and a half left. You talked about this early this morning, but can you tell about long COVID for a minute?
Well, long COVID is becoming more and more of a problem. And we're getting some new data out, both in research studies from the United States showing frequency of symptoms, both with cognition, mentation, brain fog, etc. Some studies have had this as high as 85% of individuals that have had COVID-19. And so that's quite high, probably not that high, but still very significant. If you look at the data out of the United Kingdom, they looked at their whole population and they estimate that there's 2.1% of individuals living in the United Kingdom that have long COVID. Now, that's not people who have had COVID, that is just their entire population. And the workforce in the United Kingdom has shrank by about 440,000. Of course, the United Kingdom's about 1/6 the size or 1/5 the size of the United States. And that's significant. And they feel the main driving force of that is long COVID. So this is something that we really need to prevent. We need to wear a mask, we need to get vaccinated, and to get boosted.
Thank you, Dr. Kevin Kavanagh.